Welcome to the deep dive. Look, if you're facing hyperbaric oxygen therapy, especially what they call a monoplace chamber, well, you might be feeling a bit uneasy.
Yeah, that's totally natural. Questions, maybe some anxiety about, the unknown.
Exactly. And that's what we're diving into today. We want to uh, take away that uncertainty, really break down what you can expect as a patient going through HBOT in one of those individual chambers.
Precisely. We'll walk you through the whole thing. Your first appointment, the assessment, what happens in that first treatment session.
Right.
And even, some things you might notice as you go through the course of treatment. Think of it as your guide.
Okay, sounds good. So let's jump right in. You've been told you need HBOT, that very first appointment. What usually happens there?
Well, your initial visit will likely involve a pretty detailed look at your medical history.
Okay.
The team really needs to get a full picture of your health, the specific reason you're there for HBOT.
Makes sense.
It's absolutely crucial just to make sure HBOT is the right and safe option for you.
So what sort of things are they asking about? What information do they need?
You can expect questions about past medical conditions, definitely anything related to your lungs or your heart.
Uh-huh.
And it's really important to mention if you get anxious in small spaces, claustrophobia, that's a key thing they need to know.
Right, definitely.
And of course, a full list of any medications you're currently taking. This whole review helps them spot any potential risks or things they need to be careful about.
Okay, so after they've got the history down, what comes next? Assessments.
Yeah, usually a physical exam is pretty standard.
Right.
And sometimes you might have something called transcutaneous oxygen pressure measurement. It sounds complicated, but it's not invasive.
Transcutaneous oxygen.
Okay,
Yeah.
what's that, Miguel? Basically, they put small sensors on your skin. These measure the oxygen levels right there in your tissues.
Okay. And why measured on the skin? What does that tell them?
Well, what's really interesting is it shows if your tissues aren't getting enough oxygen, that's hypoxia. And even more importantly, it can actually help predict if HBOT is likely to help you. They might do a short test exposure.
Oh, right.
And if those sensors show a good jump in oxygen delivery to the tissue when you're under pressure, that's a really strong sign that the full course of treatment could be beneficial.
So it helps personalize the plan.
Exactly. It lets the team really tailor the treatment plan just for you.
Yeah, that's really quite clever. Now, I imagine some people might still be feeling pretty nervous at this point. What's key to remember here?
The main thing really is that the whole team is there for you. They'll explain everything step by step, answer all your questions, and specifically talk through any worries you have about the chamber itself. Just, communicate openly. That's the foundation for feeling comfortable.
Good advice. Okay, so assessment done, plan in place, ready for treatment. Let's talk about that first session. Seeing the monoplace chamber. What's it actually like?
So a monoplace chamber, it's an individual unit just for you, and typically it's made of clear acrylic.
Clear? Okay, so you can see out.
Exactly. And that transparency is a huge plus for a lot of patients. You can see the room, the staff. It makes it feel much less enclosed.
That would definitely help with feeling anxious, I think. And what about talking to the staff? Are you just sealed in there?
Oh, no, not at all. There's always a communication system built right in, like an intercom.
Okay.
So you can talk to the staff outside the chamber anytime you need to. Plus, there are trained professionals right there monitoring you the whole time, ready to help. Your safety is absolutely number one.
It's very reassuring. So you're about to go in for the first time. What happens right before you get into the chamber?
Well, they'll give you clear instructions on what to wear. Usually it's cotton clothing, or sometimes they'll provide special scrubs.
Why cotton?
It's mainly a safety thing to minimize any risk of static electricity building up in the environment because it's rich in oxygen.
Ah, right. Makes sense.
And you'll also need to remove certain personal items, things like electronics, lighters,
Yeah.
anything that could be a safety risk.
So fire safety is a consideration.
It's a very, very rare concern because the protocols are so strict, often following NFPA standards. Those are National Fire Safety Guidelines. But yes, they take every precaution very seriously.
Good to know. Okay, safety check's done. You're in the chamber. Ready to start. What's the next step?
So the process starts with compression. This just means the pressure inside the chamber slowly, gradually increases up to the level prescribed for your treatment.
And what does that feel like?
As the pressure goes up, you might feel a sense of fullness or pressure in your ears. It's very similar to being on an airplane taking off or landing.
Oh, okay, that popping sensation. Can be uncomfortable sometimes. What do you do about that?
Yeah, it can be, but they'll teach you some simple tricks to equalize that pressure. things like swallowing or yawning,
Huh?
or something called the Valsalva maneuver. That's where you gently pinch your nose and try to blow out through it.
Right.
The really important thing is to tell the staff immediately if you feel any discomfort. They can help you with the techniques, or they can even slow down the rate of pressure change if needed.
Okay, good. So they can adjust it. Right. You've reached the target pressure.
Yeah.
What's happening during the main part of the session?
Once you're at the right pressure, you'll start breathing 100% oxygen.
Pure oxygen.
Pure oxygen, yeah. Usually through a mask that fits over your nose and mouth, or sometimes a clear hood that goes over your head.
Now, that's the therapy part, right? The high oxygen.
That's the core of it, exactly. That combination of higher pressure and pure oxygen allows way more oxygen to dissolve into your bloodstream than usual.
How long do these sessions usually last?
It varies based on your condition and treatment plan, of course, but sources often mention somewhere in the range of 60 to maybe 90 minutes at pressure.
Okay, an hour to an hour and a half. What can you actually do in there for that time?
Well, you can usually just relax, maybe read a book, if that's allowed and safe.
Uh-huh.
Some chambers might even have a TV mounted outside you can watch through the clear wall. Basically, the goal is just to make you comfortable while the therapy happens.
Right. Okay, so the treatment time is up. How do you get back to normal air pressure?
It's basically the reverse of going in. It's called decompression. The pressure inside the chamber is lowered, again, slowly and gradually, back down to normal room pressure.
And controlled the whole time.
Absolutely. Just like the compression, it's carefully controlled and monitored by the staff. You might feel that ear sensation again as the pressure decreases, but the same techniques work swallowing, yawning.
Got it. So that covers the first session. What about over the whole course of treatment? Are there other things people might experience? Sensations or changes?
Yeah, over the full course, you might still get that ear fullness during compression and decompression sometimes. So just keep using those techniques and definitely let the staff know if it's bothering you.
Yeah.
Some people also report temporary changes in their vision. It's usually minor and resolves after treatment stops, but it's something to be aware of.
Vision changes. Interesting. Anything else? Any risks?
Well, there is something called oxygen toxicity, which can happen with high oxygen levels under pressure. But, and this is important, the risk is quite low at the typical pressures used for most HBOT treatments, like around 2.0 to 2.5 times normal air pressure.
Right.
The treatment plans, the protocols, are specifically designed to keep that risk absolutely minimal. They build in breaks from breathing the pure oxygen, for example.
So it's managed carefully.
Very carefully. It's always about balancing the benefits against any potential, though rare, side effects.
Okay. Are there other, maybe more subtle effects of all that extra oxygen?
Yes, definitely. On a physiological level, the increased oxygen can actually help your body break down blood clots more effectively. That's called fibrinolytic activity. And it can sort of rejuvenate tissues that have been struggling because they weren't getting enough oxygen, due to hypoxia.
How does that help with healing, say, a wound?
Well, for something like a non-healing wound, that extra oxygen really gives a boost to the cells that do the repair work, like fibroblasts. It can also help fight off certain types of bacteria that don't like oxygen-rich environments, and it can help reduce swelling or edema.
You mentioned neurological conditions, too.
Yeah, for certain conditions, improving oxygen delivery to the brain might offer neuroprotective effects. But again, it's important to remember these are potential benefits. HBOT aids the body's processes, but individual results will vary.
Of course. What about the mental side? You mentioned claustrophobia earlier. Can being in the chamber bring on anxiety during the treatments?
It certainly can for some people, and that's perfectly understandable.
Yeah.
The key things to remember are you can always talk to the staff through the intercom. Always.
Right, that constant contact.
Exactly. And the staff are very experienced in helping patients who feel anxious. They have strategies. They can talk you through it. And like we said, the fact that the chamber is usually clear often really helps reduce that closed-in feeling.
Okay. And thinking about the reason someone's having HBOT in the first place, what changes related to that condition might they notice? What should they look out for?
Well, the whole point is to help heal or manage the underlying medical issue, right?
Right.
So if you're being treated for, say, a difficult wound, you might hopefully start to see signs of improvement over time. Maybe it looks healthier, starts getting smaller, or in other cases, like maybe certain infections or helping a skin graft take better. The increased oxygen is working behind the scenes to support that recovery.
So just pay attention to how things are progressing.
Yes, absolutely. And again, talk to your medical team. Tell them about any changes you notice, good changes, or any new sensations or symptoms you experience. That communication is vital.
It seems like that's the recurring theme: communication.
Right.
If you had to give one single piece of advice for someone going through HBOT, what would it be?
Honestly, it
Hmm.
really is. Keep talking to your medical team openly and consistently.
Yeah.
Report anything new, anything unusual, any concerns you have at any point during the treatments. It just helps them monitor you effectively and make sure everything is going as smoothly as possible.
Okay. So wrapping this up then, what's the main takeaway for someone who's maybe feeling a bit apprehensive about starting HBOT in a monoplace chamber?
I think the biggest thing is that just understanding the process, knowing what to expect step by step, can make a huge difference in easing anxiety.
Taking the unknown out of it.
Exactly.
Mm.
Knowing about the assessment, what the chamber is like, what happens during compression and decompression, what you might feel, it just makes the whole thing feel much less intimidating, more manageable. It can be quite empowering, actually.
And remembering that the team is there to help.
Absolutely. They're your partners in this. They're there to guide you, support you, answer every single question you have along the way. Don't ever hesitate to ask them anything about your treatment plan.
Right. Well, as we finish this deep dive, maybe a final thought is just to remember that, the body has this amazing ability to heal. And therapies like HBOT are really just tools to help support that natural process. Hopefully this conversation has left you feeling more informed, more prepared, and ready for your treatment journey.